Hello, greetings. Welcome to this week's episode of Unpacking and Unboxing. Today we have this Pokemon mystery pack right here, and we are opening this today. And then, by the way, if you like this content, please hit subscribe and smash that like button. Okay, let's open this pack here. Okay, let's see. Seizures here. And let's see what we have here. Oof, this one here. Okay, perfect order, perfect order. Okay, all perfect orders. All right. Okay, let's open pack number one here. Energy. Okay. All right, let's see. Okay. All right. Do you guys want to also find out about the acute coronary syndromes? Okay, so signs and symptoms and diagnosis are complication of acute coronary syndromes. Okay, it is caused by blockage of blood flow in the coronary arteries, and also that causes a clot formations and plaque buildups inside of your arteries, which also causes chest pain when you have that, and then creates a pressures on the chest, all right? And it may present with atypical symptoms in female. If you're elderly patients, you might experience some arm pain, back pains, fatigue, and then central nervous system changes. It also shows the symptoms of lightheaded, dizziness, possible nausea and vomiting, and also has some symptoms of STEMI and cardiac biomarkers elevated. You might gonna see elevated troponin and CKMB levels, and which indicates the cardiac damages, and basically your muscle cells are breaking down. And the common risk factors of a acute coronary syndromes is age. If you're a man of age of over 45, or woman's of age of 55, if you're also smoking and it has a diabetes and dyslipidemia, meaning that you have uncontrolled high level of cholesterol, especially your LDL level is high and triglycerol glyceride that level is high and overall cholesterol level is high. Okay, let's see here. Open. Let's see what we have in this one. I think we got one more card. Oh, it's a shiny. Uh, okay. Is this the last card? Yeah. Okay. Well, at least these are sort of shiny here. All right. Moving on to the next pack. Okay. Here we go. Okay. So some of the medications are using for treating for the people with acute coronary syndromes are the aspirins. And then we also put the patients in the statin therapies. And then also we give them in the ACE inhibitors, and then ARBs, which is like you probably know a lot of those, like losartan, most definitely losartans, and a lisinopril. You do see you being seen a lot. Some of the statin therapy we're putting on there is Lipitor, atorvastatin, and rosuvastatin, which is Crestor. Uh, does a pretty good job. So by the way, and also give it a better part. By the way, statin drugs are the first drug that went through the clinical trials and show the benefits of taking those medications. Anyways, okay, let's see. Scatterberg. Hunters. focus here. Okay. We have quite a bit of patients are on the drug in terms of preventing possible cardiovascular events, aspirins, blood thinners. The reason that diabetes patients have a higher chance of getting that is when you have lots of sugars. I mean, depends on who you are. If you're smoking, which damages your uh, blood vessels, and then when you're having diabetes and you have a elevated amount of sugars and you got lots of cholesterol in your bodies, what's gonna happen is there's gonna be struggling staggle there to the scar tissues because those free radicals and all bunch of chemicals were causing a scar tissue buildups, and because it damages blood vessels and your platelets and all the anticoagulants in your blood, we're trying to heal that, but in the process of doing that, it causes a scar tissues in there, and the sticky bloods are sticking there and causes a clot. And cholesterol, a high level of LDL and triglycerides, it also makes it build much more build up plugs inside of the vessels. So that's why you have a hard chance of getting those uh, coronary disease. All right. Okay. So we are moving on to the best parts of this pack. So Spirit C, and then we have Hippo. How do I read this one? Hippopotas. Hippopotas. I think this Pokemon is in which version? Black and white? No, later version, right? I don't remember exactly. No. Oh no, no. It's from Diamonds and Pearl. Diamond and Pearl versions. Okay, Landros. Oh shit. No hits. Okay, okay. Well, don't get disappointed. We still have this last pack right here. Oh, come on. Come on. Come on. Cold card. Come on, man. Come. Pokemon catchers and Ghastly. Okay, focus here. Oh, Geobusters. 350 damages. Discard all energy from this. Oh, anyways. You need to have a Mega Zygrades EX. Discards. Okay, anyways. Okay. Poison. Your opponent's active Pokemon is now poisoned. During your opponent's next turn, that Pokemon can retreat. All right. Although I love you, I use it a lot in black and white version, black 2, white 2 version, and I use it also a lot in the Pokemon TCG game. Is this Oscar? Oh wait, this is a last card. Is energy? Man, got nothing. Well, at least this one was some sort of shiny here. Okay, well, there we have it. Hey, thanks for watching this video, and see you in the next episode. Take care, guys.